Today we will talk about tuberous sclerosis. My name is Ani Hoja. I am a radiology resident at Mother Teresa University Hospital Center in Tirana, Albania. Disclosures: working as a social media assistant editor at AJNR. Tuberous sclerosis complex, or Bournville disease, is a neurocutaneous disorder characterized by the development of multiple benign tumors of the embryonic ectoderm, affecting skin, eyes, and central nervous system. Etiology: these are mutations in TSC1 or TSC2 genes. It is an autosomal dominant, but 70% of cases are sporadic. 50 to 86% result from random mutations. The rest are inherited in an autosomal dominant pattern. About 80% involve mutations in mTOR pathway tumor suppressor genes, TSC1, which produces hamartin, and TSC2, which produces tuberin and accounts for most cases. Clinical presentation: tuberous sclerosis typically presents with skin lesions, such as hypopigmented macules, facial angiofibromas, fibrous plaques, neurological issues such as seizures, intellectual disability, autism, and organ involvement, kidney angiomyolipomas, cardiac rhabdomyomas, and lung lesions. Imaging features: neurological ones, we have cortical tubers, subependymal nodules, subependymal giant cell astrocytomas, white matter lesions, hydrocephalus, and calcifications. Abdominal features: renal angiomyolipomas, renal cell carcinoma and oncocytomas, gastrointestinal polyps, pancreatic neuroendocrine tumors, and hepatic angiomyolipomas. Thoracic features: lymphangioliomyomatosis, multifocal micronodular pneumocyte hyperplasia, cardiac rhabdomyomas, thoracic duct, and aortic pulmonary artery aneurysm. Musculoskeletal ones, we have hyperostosis of the inner table of the calvaria, periosteal new bone formation, sclerotic bone lesions, scoliosis, and bone cysts. Skin, we have hypopigmented macules, facial angiofibromas, fibrous plaques on the forehead. Imaging findings of neurological involvement in tuberous sclerosis. So, understanding clinical manifestations and imaging findings. Main findings are cortical tubers. These are areas of cortical dysplasia that disrupt normal brain architecture. They are the major cause of epilepsy, especially early onset seizures. They are linked to cognitive impairment and development delays. On MRI, they appear hyperintense on T2 weighted and FLAIR sequences, hypo or isointense on T1 weighted sequences. The best visual aid example is a T2 weighted axial MRI showing bright focal areas of cortical dysplasia, and it might also be associated with cortical thinning. You can see the images on the right. You have hyperintense cortical lesions on T2, and the arrows are actually pointing at those lesions. The second main findings are subependymal nodules. These are hamartomas located along the walls of the lateral ventricles. They are usually asymptomatic, but their growth into subependymal giant cell astrocytomas can lead to hydrocephalus. They are really important for tuberous sclerosis complex diagnosis as they are a hallmark feature. On MRI, they have a variable signal, frequently high T1 and ISO to high T2. Visual aid: an axial T2 weighted MRI image displaying multiple hyperintense nodules along the ventricular walls. So you can see the nodules along the ventricular walls in the image to the right. Another finding is subependymal giant cell astrocytoma. These are benign tumors that can arise from subependymal nodules, typically near the foramen of Monro. They can cause obstructive hydrocephalus, leading to headache, nausea, vomiting, and papilledema. On MRI, they appear as an enhancing mass on post-contrast T1 weighted images and ISO to hyperintense on T2 weighted sequences. The best visual aid is a sagittal post-contrast T1 weighted MRI image highlighting an enhancing mass near the foramen of Monro, which is suggestive of a subependymal giant cell astrocytoma. The image on the right shows a sagittal post-contrast T1 weighted MRI image with an enhancing mass near the foramen of Monro. Another finding are white matter lesions. These are areas of dysmyelination or abnormal myelination. The clinical signs are that they might be associated with cognitive impairment and behavioral disorders. They are also linked to disrupted neural migration during brain development. Imaging correlations. On MRI, in a T2 weighted or FLAIR sequence, they appear as hyperintense lesions in the subcortical or periventricular regions. A visual aid could be an axial FLAIR MRI image showing hyperintense lines extending from the ventricles to the cortex, known as radial migration lines. Cephalus due to a subependymal giant cell astrocytoma. Obstruction of the cerebrospinal fluid flow by a subependymal giant cell astrocytoma can lead to hydrocephalus. So it is caused by the obstruction of foramen of Monro from the tumor, and symptoms include increased intracranial pressure and development regression. MRI characteristics, we see dilation of the lateral ventricles and the presence of an obstructing mass near the foramen of Monro. The best visual aid would be an axial T2 weighted MRI image showing ventricular enlargement with the mass causing obstruction. On the right, we have some CT images showing a mass arising from the left lateral ventricle and actually causing dilation of the ventricles due to the obstruction of the foramen of Monro. We also see some calcified subependymal nodules, and this is actually a CT of the young boy diagnosed with tuberous sclerosis. The 7 findings are calcifications. These are much more common in subependymal nodules than cortical tubers, especially in older patients. They are usually asymptomatic, but they are very helpful to diagnose tuberous sclerosis. On CT, they appear as hyperdense foci along the lateral ventricles and within cortical tubers. They may appear hypointense on MRI sequences. The best visual aid would be a non-contrast CT scan displaying hyperdense nodules along the ventricular walls indicative of calcified subependymal nodules. The image on the right shows calcifications in the brain parenchyma in a boy diagnosed with tuberous sclerosis. Thank you for your attention. Here are the references used for this presentation.